Domestic violence and sexual assault is happening every single day, even if it's not being reported. And so our services are providing free and confidential services to anyone.
Each day can be a battle, and some days are easier than others. But ultimately knowing that every person that we encounter and working towards being able to help in any way that we can has that ripple effect.
If you've never been through that situation, you don't know what to expect. And when you don't know what to expect and you don't know the processes that are involved, it's scary.
I've had cases where survivors are still trying to divorce their abusers 2 years later, and that abuse is continuing to happen. Whether they're married or have kids, they're still continuing to have to either co-parent or see their abuser very often, and so that abuse is not stopping.
Riverview Center's mission is assisting clients within the communities that we serve who are survivors of sexual assault, sexual abuse services, and in Illinois, we also handle domestic violence services. We serve 16 counties total. We serve 14 counties in Northeast Iowa, and we serve 2 counties in Illinois. A lot of the services that we provide are immediate response to crisis intervention. So if someone reports to a law enforcement center and needs to report sexual assault or domestic violence, we are oftentimes called upon immediately from law enforcement to serve in an advocacy capacity. Same thing goes with emergency response to hospitals. We are oftentimes the very first person that's called when someone reports to a hospital and wants to report a violent crime that's happened to them.
The majority of my job is going to court with survivors, either civil or criminal court. We do a lot of domestic violence education with survivors, economic assistance, housing, childcare.
The need for a bilingual advocate was huge. I work with marginalized populations, I work with Hispanic, and I work with African Americans, I work with refugees and immigrants. I help them with resources. So I do medical advocacy, legal advocacy, general advocacy, and peer counseling.
We have a preventionist that goes to the schools, provides information and sessions to kids on bullying and body safety, things like that.
Really anything that has happened to our survivor, we help them navigate through different systems and helping them through their struggles.
The other thing we do is we do a lot of long-term counseling and therapy services, so more in-depth, therapy services.
Trauma affects all aspects and all areas of a human being, from development, literally growth and development, emotion, spirituality, sense of self, all of those different areas. So when we're talking about working with individuals from a trauma-centered perspective, really that's that focus in being able to address that trauma.
We work very hard to let men and boys know that we're available, to let immigrants, maybe undocumented immigrants, know that we're available to them as well. The other big thing about our services is everything that we do in this organization is 100% free and 100% confidential. So we will never ask if you have insurance, and we will never ask for payment. There's no sliding fee scale here. We are funded by the communities that we serve. We are on call 24 hours a day, 7 days a week, and we're there to serve the communities that we have been entrusted to serve.
I had a client that firmly believes that the services that were provided to her saved her life, that we were a lifeline to her and her voice when she didn't have one.
What I do is important for the community because everybody needs some kind of support.
I am absolutely honored, whether it's the smallest of children or some of the seniors that I work with, for being able to be a part of their journey.
And those little wins, whether it's with educating a police officer that domestic violence isn't just a home issue, or getting a judge to understand that maybe someone needs extra help. It's making small strides to hopefully end domestic violence and sexual assault.